Can blood tests tell what type of arthritis you have? Imagine trying to solve a puzzle about your joint pain. Blood tests can be like clues in that puzzle, but they don't always give the full picture. When doctors try to figure out what kind of arthritis someone has, they look at many factors. Blood tests are especially helpful for identifying inflammatory types of arthritis, like rheumatoid arthritis. These tests check for specific markers that show inflammation or autoimmunity. For example, rheumatoid factor is an antibody found in about 70 to 90% of people with rheumatoid arthritis. However, it can also appear in healthy people or those with other diseases. Anti-cyclic citrullinated peptide antibodies are more specific to rheumatoid arthritis and can help confirm the diagnosis. Blood tests also measure inflammation markers like erythrocyte sedimentation rate and C-reactive protein. These tell doctors if there is active inflammation but don't specify which type of arthritis is present. In contrast, osteoarthritis usually doesn't show abnormal results in blood tests. It is a degenerative joint disease caused by wear and tear, not systemic inflammation or autoimmunity. When diagnosing osteoarthritis, doctors relying more on symptoms like joint pain and stiffness, especially after activity. Physical exams and imaging tests like Xrays are key. Xrays can reveal joint space narrowing and bone changes typical of osteoarthritis. Researchers are working on new methods, such as analyzing joint fluid for metabolic markers. These could someday help distinguish osteoarthritis from inflammatory arthritis more accurately. But for now, blood tests mainly help rule out other types of arthritis. They are valuable tools for identifying autoimmune conditions like rheumatoid arthritis but are not definitive for osteoarthritis. So, to answer the question directly, blood tests can tell if you have an inflammatory arthritis like rheumatoid arthritis, but they can't confirm osteoarthritis on their own. Diagnosing osteoarthritis depends on symptoms, physical exams, and imaging studies. Blood tests are mainly used to exclude other types of arthritis and guide the overall diagnosis process.